Today we're talking about something pretty incredible, how a totally routine trip to the eye doctor could actually give you the very first warning signs of some serious stuff going on with your heart and your brain. It's a checkup that could do way more than just save your sight. It could literally save your life.
I mean, just think about this for a second. What if a simple eye exam could predict your risk for a stroke or a heart attack, or even give clues about Alzheimer's long before you ever feel a single symptom? Sounds like something out of a sci-fi movie, right? But it's not. This is happening right now. So, how on earth is this possible? Well, the answer is all about how unique our eyes are. They're basically a direct, open window to what's going on inside of us. I mean, think about it. There is no other place in your entire body where a doctor can see your blood vessels, your nerves, and even brain tissue just sitting there in its natural state without having to make a single cut.
So yeah, this idea of the eye as a window to health, it's not just a nice saying, it's a physiological fact. And it's transforming the simple eye exam into an incredibly powerful screening tool. So let's break down exactly how this works.
Okay, so the key to all of this is a part of your eye called the retina. Now, we usually just think of it as the film in the camera, right? But it's so much more than that. When you were developing as a fetus, the retina actually started out as brain tissue that literally pushed forward into the eye. This means looking at your retina is the closest a doctor can get to taking a non-invasive peek at your central nervous system. It's wild.
And this really changes how we should think about an eye exam. We're moving way beyond the simple question of, is my prescription up to date, to something way more profound, like, what's the real-time health of my body's entire circulatory and nervous system? It's a total paradigm shift.
All right, so let's get into the specifics. What are the signs? Let's start with the first big one. It's a condition that affects millions of people, a lot of whom have no idea they even have it. High blood pressure. You know, the silent killer. So when your blood pressure is constantly high, it puts this huge strain on the tiny, delicate blood vessels in your retina. And that damage has a name: hypertensive retinopathy. An eye doctor can see it plain as day. They might spot arteries that have gotten narrower or tiny little bleeds. They can even see these fluffy-looking things called cotton wool spots, which are actually little areas where nerve fibers have died off from a lack of blood flow.
And this is where it becomes truly a life-saving moment. You know, a patient might walk in just thinking they need new glasses, but their retina is screaming that they have dangerously high blood pressure. Catching that can trigger urgent treatment and potentially prevent a massive heart attack or stroke down the road.
Now, from one silent threat to another. Your eyes can also give us some of the earliest, most direct warnings that you might be at a high risk for a stroke.
What's so amazing here is that we're talking about visible, physical evidence. A doctor can look in and literally see a tiny, glistening piece of cholesterol, it's called an embolus, that's gotten stuck in a retinal artery. And that little plaque, it's a massive red flag. It tells the doctor that there are probably bigger, unstable plaques in the major arteries in your neck, and the very next piece to break off could go straight to the brain.
And there's also this really specific symptom that nobody should ever ignore. It's a condition called amaurosis fugax. It feels like a temporary, painless blackout in one eye. People often say it's like a curtain coming down over their vision. This is, for all intents and purposes, a mini stroke, a TIA, happening in your eye. It's a critical, urgent warning that a much bigger stroke could be right around the corner.
Okay, now we're moving into the real cutting edge of neuroscience. Because the retina and the brain are so intimately connected, researchers are discovering that the absolute earliest signs of diseases like Alzheimer's might actually show up in the eye first.
The parallels that scientists are finding are just remarkable. You know those abnormal protein deposits found in the brains of Alzheimer's patients? Well, they're now being seen in the retina too. On top of that, they're measuring a thinning of the nerve layers and subtle changes in blood flow, all of which could be biomarkers that show up years before any memory loss starts.
This points to a truly incredible future for early detection. I mean, just imagine this. You go in for a regular checkup, you get a quick, non-invasive eye scan. An AI algorithm analyzes that picture, finds these super subtle patterns, and flags a risk for Alzheimer's maybe a decade before symptoms appear. This could completely change the game for how we approach neurodegenerative diseases.
Let's move on to our fourth sign, and this is one of the most common things that eye doctors discover. A lot of people find out for the very first time that they either have diabetes or that their diabetes is poorly controlled, not from their family doctor, but from their optometrist.
See, high blood sugar is basically toxic to the retina's delicate little blood vessels. An eye doctor will see them start to leak fluid and blood, and that causes swelling that can make your central vision blurry.
In the later stages, the eye tries to grow new, abnormal blood vessels, but they're incredibly fragile and can lead to catastrophic bleeding and permanent scarring.
But, and this is a really important but, there is some good news here. If we catch this damage in the early stages, we have incredibly effective treatments that can stop the disease in its tracks and save a person's sight. So the key, like with everything we've talked about, is catching it early, often before you even notice anything is wrong with your vision. So let's bring this all together. It's pretty clear that a comprehensive eye exam goes so far beyond just making sure you can see clearly. It's a critical, vital tool for protecting your overall health and, honestly, in some cases, your life.
The big takeaway here is that your eye doctor is in this really unique position. They are often the very first healthcare professional to spot the silent signs of uncontrolled high blood pressure, undiagnosed diabetes, a serious stroke risk, and maybe even the earliest changes related to brain disease. So what's the actionable advice? What should you do with this? For most adults, especially if you're over 40 or have other risk factors, getting a comprehensive, dilated eye exam every 1 to 2 years is an absolutely essential part of your health routine. It's not a luxury, it's a necessity.
So we'll end on this thought. Your eyes are your main connection to the world around you, right? They let you see everything beautiful and important out there. But what are they showing about the world that's within you? A world of hidden clues that could protect your entire future. Thanks for tuning in.